everyone. I'm Dr. Kavita, and welcome to the Unlearning Podcast. Today I have with me two very special guests, friends, and technically first friends of my husband's, but now they're mine. Dr. Katie Ahmadzadeh and Dr. Mary Gallo, who are both ER physicians. Dr. Katie Ahmadzadeh has been practicing for 11 years as an attending physician, and Dr. Gallo has been practicing for more than 8 years. So they bring a lot of expertise to the table, and they've been moms. I think, after being attendings, you became moms after. So, and we're going to get into that. So today we're going to talk about how our experiences are like as working moms and working physician moms in particular. And I think that could easily be a whole series, but we'll see what we get out of today. And there's so much we could talk about and dive in. So so thank you for being here and joining me today for this very special talk and this topic. So I'm so excited. Before getting on the show, one of the first things I had mentioned as far as topics was this myth that's not just for working moms or working physician moms of being able to do it all. I think it's relatable for anybody. But have you felt that, like that pressure, or like had that in your mind, the need to I got to make sure to get all these, everything done more so?
Yeah. I mean, absolutely. I feel like before I became a mom, I feel like this image is everywhere of, the mom. She wakes up and she's in perfect shape and she's well dressed and she's, cooking the breakfast for her kids, and she's getting them off to school, and then she's going off to work, and the house is perfect. And, I think early on I realized that wasn't going to be me, and it took me a long time to realize that I think that's not most moms. That's not a realistic viewpoint or expectation. And for a while, it was always like, I'm failing, because I'm not living up to this idea in my mind of what I think a working mom should be. And definitely had to unlearn that line of thinking.
I liked how you worked in unlearn.
I love that. Thanks. I appreciate that. You put that in there. I know there was a lot. I feel the same way. I feel like I had rose tinted colored glasses about motherhood and had it on a pedestal before actually becoming a mom. And I thought, okay, having like a child psychiatry background and knowing about development, that's gonna, help me. And then actually, after becoming a mom, I'm like, wow.
Tumbling.
It hit me. Tumbling. It's being on the other side as a parent. It definitely was like a glass shattering experience of how it's really like. And I still think sometimes wow, how are we all doing it like this, with working too? And by the way, if you're a stay-at-home mom, you're still working too. Or this is, and this I think even, goes beyond, I know it's mostly moms that are referred to in this context, but there's also stay-at-home dads or other caregivers. So just to put that out there. But oh my goodness, the day-to-day grind of it all, it just makes me think of how when my parents said, you're going to know when you're a parent one day, and I totally didn't understand that, and now I totally do.
Until you have that perspective. It was very humbling for me, because I thought, I got this, I'm an EM doctor, I can handle the emergencies and the colds and the things that crop up, but there's so much more to being a parent than that side of things. And so it was definitely a lot of wow, you really underestimated what this was going to be.
I kind of thought too, there's you think you have this emotional resilience, but they're asking you to do something that's physiologically impossible, right? We have very demanding jobs, and you're 36 weeks pregnant trying to intubate or suture or, deal with an agitated patient. And it's too much to ask of anybody. And then you think, well, everyone before me did this, why can't I do it? And I think that just continues, right? When you have to come back to work when your baby's 11 weeks old, or you're up all night breastfeeding and then you have to work a 12-hour shift. I think we, the way our modern society is set up, and our specialty in particular, just ignores that we're actual people with real physical needs that are unmet.
Yeah, definitely.
Absolutely a great point. Yeah, I remember I was probably about that pregnant and I had to intubate this patient in DK, and one of our older male colleagues was like, "You want me to do it for you?" And I was like, "No, I don't, because
Good.
I'm still," and I felt like it was almost like I really had to like drive that point home hard, you know, like, nope, I'm still very capable of doing this and I'll figure it out. And it was fine. So.
And it worked out. That's great. I love that you said, no, thanks, I've got this. Yes.
Did you find a little bit like maybe I should have got the help, or you didn't want the help, or how did it?
I mean, I felt confident. Like, obviously, I would never put someone's life in danger if I felt like I wasn't capable.
No.
Yeah, I'm not reducing a hip 36 weeks pregnant, for
Mm-hmm.
sure. But no, I felt like I got it. But I also felt like it was like I really needed to let him know that was, I don't know, felt kind of inappropriate. You know, like my brain is still working, my physical capabilities are still there, you know.
Right.
Yeah, like someone who wants to be an ally, how do they offer support without undermining your capabilities? That is like a tough line to walk. Yeah.
That's a great point. Right. Yeah, I think that's a great way to put it. Like, you know, to be an ally and supportive versus like how that particular colleague was like, yeah, I don't know if you can do that. You know, you want me to step in for you? Right, with that. And I wonder, because he's an older gentleman too, that could be from the generation he grew up in, and a lot of patriarchy still embedded in there.
Well, and I think that's sort of why it's so off-putting, you know, like I know it was coming from a good place. I know he wasn't meaning to be offensive, but I feel like, especially in our jobs, it's very much we expect this to be a male physician role. And so I feel like we come up against that a lot. And so when those things come up, they're particularly triggering, I would say, you know. Yeah.
Absolutely. I could imagine, especially for you two in EM, where it's a male-dominated specialty still. And I still hear stories, like it's like in today's day and age, current times, of those like old, what's the word? It's like there's still that idea of like, oh, I expect there to be a male physician in like, you know, coming to see me. Like, where's the doctor? Like, I still hear from Sheol, my husband, by the way, who's also an EM doctor, that, you know, the patients still say that sometimes. I find that unbelievable.
I would say almost, it feels like almost once a shift.
I would say that.
Wow.
Yeah, I would say it is frequent. I think that's a whole nother. I think times are changing though. Like because I think more and more I think being a mom made me a better doctor, and I can relate to patients and families better. So when I'm saying like I'm a doctor and I'm a mom, I think it gives what I say
street cred.
Yeah, like they're like, well, you understand, right? But then there are patients who are like, I don't fit their image of what a doctor is, or I'm much more willing to say that, you know, I don't know the answer, or I made a mistake, and they're like, well, doctors don't say that. Are you a doctor? It's like, yeah, no, definitely I am. You know, like
right. I remember learning that in training, where it's okay to say, I don't know, and I will find out. And as physicians, we're lifelong learners. And I feel like, you know, that the field, or just in medicine in general, it brings in people who are naturally curious and want to be continuously learning. And yeah, there is that image, I think, to kind of also shatter of, wait, you're my doctor. Aren't you supposed to know everything? What do you mean you're saying, I don't know? What? Yeah. But we're humans too. I think that's another thing to kind of bring up as an unlearning point, that we are, like, there's this image of being a superhero as a physician, and it's like, no, we have families and our own lives, and we have to take care of ourselves. And, you know, as moms especially, we have our kids, and we're human still, because sometimes for me, I know I'm in a different setting. I'm in the outpatient setting as a child psychiatrist, and I totally get it as far as access, where we're usually booked out quite a bit and patients are waiting a while to see us, and I really feel for that. And at the same time, if let's say they've been waiting a month or two for an appointment and we get sick and we have to cancel last minute, some parents get really angry, and I get that. And at the same time, though, I'm not going to be able to do my job as well if I try to push through and work when I'm not feeling well. I'm not going to be giving the best care. And so I think it's a good example to set for everybody, where, you know, you are taking that step back and saying, okay, I need to take the day off. I'm not feeling well, or just because I feel like in medicine, or at least when I was in school and in training, it's like you push through. At least definitely pre-COVID times, it was a badge of, it was seen as a badge of honor. Exactly. Like, oh, you're showing up to work sick, look at you. Like, as if that's a sign of resilience. I love that you brought up emotional resilience earlier, but wait a minute, no, that's you further burning yourself out. And I think that's another huge thing that I think, like you said, there are things that are like changing with the times and that we are unlearning. And I think that's one of them. Like those who are in med school now or in Gen Z, I feel like are more like, no, I'm not going to do that. They have those boundaries. Yeah, it's not seen the same way as like a badge of honor to, you know, push through. Oh, yay, you came into work and you're sick. Oh, yeah, you should. Okay, good. Yeah. It's now kind of strange. Look at you, soldier. Yeah, exactly.
I 100% agree. But they're not that we're not staffed to the way that if someone calls off, we are short-staffed, and patients are not. You know, patients are the priority. And like, how do we balance? I need to go to work. I need to see patients with. I'm too sick to go to work. I remember in residency, they used to tell us either you check in as a patient because you're so sick, or you come to work. That was the two options. There wasn't you could stay home, right? So even this winter, I worked with Flu A because I just put a mask on and went to work because I didn't want to call off.
Oh
right?
my.
So
it always feels like it has to be some extreme circumstance. But I think that brings up a good point about balancing self-care with our jobs. You know, I think early on, I was just kind of like in the trenches, trudging through, and I stopped working out and I stopped doing all the things that I needed. And I quickly learned that I was a better doctor, a better mom when I continued to do those things for myself. So I get my monthly facial.
I love it.
It shows.
Yeah, it shows you're glowing.
And my skin's not the same. And I feel better when I do it.
That's great.
I think I had this idea when I was first starting that I wouldn't go part-time right away. I was like, I need to get like 5 years under my belt, full-time work. That's what I had. I don't know why you get like these ideas that, I have to do that. And it became, I mean, you guys know my story. Like it became like very much not a priority to be full-time when Claire was my daughter, who has special needs. She has a rare chromosomal disorder. She, like, when I realized like, wow, something's really wrong. I really need to be at home. I was like, work is not the priority. Like I need to, when I'm there, it's the priority, right? Because when you're at the shift, you have to do what you can for patients. But I got to limit that time. So that was like that was at least one of those very easy decisions early on. Like, I am cutting back my hours. I need to be home more so that I can be with her. She really needed me. And there's a lot of people who could do our jobs, right? Well, maybe not a lot of people. We have hard jobs, EM. But
sarcasm.
And like, I appreciate all the investment like both personally and that other people put into me to make me an ER doctor, right? Like all the people in our residency who like said, you know what, I want Mary to be the best ER doc she can be. I'm going to teach her how to do this. I'm going to talk through this differential with her. And I really value that. But I think
there's a lot that goes into training a physician.
Oh yeah. So like I do like all of that. Yeah. And I don't want to give that up. It means my career means a lot to me. But I always have that like one anchor of I am replaceable at work and I am irreplaceable at home. And like I can scale up and down at work. I can't really do that at home. Like your kids need you. Your family needs you. It is a tough balance, right? And then that changes a lot when the kids are young, or like when Claire was first getting diagnosed versus as they get older, right? They have different needs, different how much you need to be at home.
For sure.
Yeah, I think it also brings up, we're still figuring out as a society, we need women in the workforce, right? I mean, we make up a significant portion. I don't know the statistic offhand, but I would suspect half, if not, slightly more. Women have to work. We need that section of the workforce, but we're not given, I feel like we're sort of set up to fail, if that makes sense. We need to figure out as a society how we can keep women in the workforce, but also allow them to do what needs to be done at home,
Yes.
And that's obviously very complicated, but I think that we need more resources, more support, because not everybody has their parents close by.
Right.
So
I feel like me and you we should be on like Capitol Hill arguing for better parental leave. Like
we don't have time.
I know, when are we supposed to do that? I get so I think about our jobs. Like I think you should have the option. We shouldn't force everybody, right? But everybody should have the option to stop working when there's 36 weeks pregnant in a high intensity career, right? If you're an ER doctor and there's high acuity patients, there's critically ill patients, there's aggressive patients, there's sick traumas, that last 4 weeks, I don't think it's safe for you or your baby to be working in the ER for some, for a lot of people. And I think we shouldn't have to come back to work when our kids are like 11 weeks, 12 weeks old.
Absolutely.
We should have 6 months of FMLA. Our jobs should be protected.
Yes.
It's just, it's so far behind modern society that we don't have that.
Absolutely. Right? Yes. I felt that way.
I remember
too.
being, sorry.
No, you're good.
I remember I don't remember how pregnant I was, fairly pregnant, and an aggressive psychiatric patient was posturing at me, and it's me and him in the hallway, and I'm just like, what am I going to do here? Like I'm looking around like, if I got to defend myself, I guess that's what's going to have to happen. But, this guy is not coming at me with my child, and those are scary situations.
Absolutely. Yes, especially for you too, in that, you're seeing, you don't know what you're walking into every time when you start a shift, and you will have patients like that. You could have one, you could have multiple or none, but the fact that you could be in those situations like that, and was security like in the vicinity, or no, you were in the hallway. So my goodness.
There really was no one around.
Wow.
Because
that's so
sometimes
scary.
that happens. People are busy with something else, and in the hallway.
One of the many occupational hazards that's there for EM. Yes, my goodness gracious. But I absolutely agree with, I would love to go to the Hill with so many different
the topics are
topics.
Yes,
right? As far as being able to have that cutoff, because that last month, once you hit the third trimester, I think, then it gets much tougher. And also on top of that, you're doing shift work where you have overnight shifts and early morning shifts and everything in between. So there's the time difference there too. I feel like that's a whole nother topic.
The circadian rhythm disruption and trying to breastfeed and pump, or like even just be there, like for the middle of the night wakenings for your baby. It's very hard.
Right. I commend you all so much that do shift work and work in the EM, like in the emergency department. And just that setting is a high stress, like, where you have like the sickest of the sick coming in, and you're pumping in between when you can, or, there's that circadian rhythm disruption or sleep cycle, like the constant changes you have to be adapting to. That's a lot of stress. So it'd be great if there would be, like, especially for jobs like this that are as high, intense, and stressful like that, to say, okay, you know, you can stay home and find some other way of like keeping work or having longer parental leave. There are other countries already that are way ahead of us as far as this, right? With having much longer parental leave, because 6 weeks for, let's say, if you have a normal vaginal delivery, and then 8 weeks for if you have a C-section. I've noticed that's in many workplaces, like the time you get, oh my goodness, the babies are not sleeping through the night yet and you're so sleep deprived. Being postpartum, it's a whole nother topic. It's just such a daze you're in. And then also being a new mom. And then when you are going back to work with this new identity, oh my goodness gracious. Yeah.
It's a lot to process. Yeah. Going back, they're not sleeping, shift work. And I took 3 months, some of it unpaid, which was fine. I was happy with that, but I still was not ready at 3 months.
Right.
Going back with all those changes and flux. And, you know, it's you've only been gone for 3 months, but you sort of when you're getting back into it, do I remember how to do all these things, you know? And you do. It's like riding a bicycle, but that, you know, self-doubt that you have where you feel a little rusty at first.
Right. No, right. And it seems like it wouldn't be like it's been just 3 months, but you have done so much in that 3 months time with learning how to take care of your baby and your healing and with like one of you had said earlier, like as our kiddos are growing and entering these different stages of development, then it's this constant balancing and adapting act of, okay, you're doing, okay, you like sleep can change, like there's sleep regressions and, you know, them learning all these new skills, especially in the first 5 years, there's so much change and you're constantly trying to figure things out. I feel there's that. I think there's some unlearning of letting go, I think, in all of that, because I wonder for you too, unlearning the need for control has been a huge thing for me, like in wanting to implement structure and routine for them. And if, you know, they're not hungry and they're, you know, running away from the table or like really sleepy and it's not their nap time yet, like trying to constantly adjust and adapt in those senses, I've learned I had to, you know, see what really matters and take a step back and regroup.
Oh yeah. I struggled a lot with, this is maybe a control or a risk averse kind of issue when Ian, like he just didn't sleep well. Like you come home, right? And they tell you you're not allowed to sleep train. So you have to go get them if they're crying. But you can't bed share. They need to be on the hard bassinet by themselves. I struggled with this so much, right? Because the guidelines are so strict. They're like, it is the only safe sleep option is for your baby to be on the bassinet. And so room share, but don't bed share. And I was like, this for me is physiologically impossible. Like I can't go back to work and work a 9-hour shift with being up every 1 to 2 hours all night long. So I ended up doing bed sharing, which is not recommended, right? So I don't know. Maybe you'll have to cut this out because it's not. This will be like cut from the podcast.
She's not promoting.
Oh yeah,
right. What works for her.
And then I'm like, a part of me is like, does this not represent medicine completely? And why sometimes patients get frustrated with us because there's this like very strict. This is the best option. You should do this. But what do you do when
what's realistic for my life?
Yeah, like that didn't work for me. So then it's like 3 a.m. and I'm Googling La Leche League, the Safe Sleep 7, how to like bed share safely. And I'm even afraid to talk to my own pediatrician about it because I'm worried he's going to be like, absolutely not, Mary. How could you do this, right? You see the kids. I have taken care of kids who've come in recently. Me and Katie had to do, you know, we had a very difficult case recently where we have kids who die at night, right? And is it SIDS? Did they have sudden unexplained death, right? We don't know why they died. Or was it suffocation because they were in an unsafe sleep environment? I never know in the ER. That's not an answer I get. No, so I see
that's an answer that we don't know a lot in general.
Yeah, even after a full like autopsy and, you know, coroner report. Yeah. So I'm making a choice that like I'm conceding control because I'm like the safest, yes, is the bassinet by themselves. That is not feasible for me. It's not working for me and my child. I have to make a different choice. And then like taking a breath and being like, that's okay. You know, like maybe, right?
It's a great point. I mean, Olivia slept in that Fisher Price rocker that was, recalled. It's considered a child death trap now, but it was the only thing she would sleep in.
Yeah.
Till she was about 5 months, and I used to wake up in the middle of the night, panicked, sweaty, because she's still breathing. Oh my God, and shake her. But it was the same thing for us. She just would not sleep anywhere else, and you get really desperate at some points.
You just like it's another like you can't overcome basic human physiology. You have to have sleep.
Mm-hmm.
Right.
It's a great point. Yeah, I feel like there's different stages of that too, because now I feel like we're starting to enter the school age and the activities, and it's hard for me to let go of all the perfectionistic tendencies where I'm like, okay, I got to set her up for the absolute best opportunities. She's got to have the best educational opportunities, the best opportunities for gymnastics. And, sometimes I have to really check myself and say like, you need to take a breath. We're probably going to a little bit too crazy a lens here to, she's going to be fine no matter what happens,
I totally get that.
Yeah.
Mm-hmm. I feel that too. I want to have the kid, like my 2 kids, set up for success and have them involved in, I have that same mindset too. And you brought up perfectionism, which is, so good to bring up, because I think in medicine, it also brings in individuals who have those tendencies, and it gets reinforced in medicine, perfectionism, especially when we're taking care of patients and we need to make sure all our ducks are lined up, or, the perfectionism is important because it could be life or death, especially in EM, where that is the big fear. And so, of course, how could it not get reinforced? But being able to step back when it comes to balancing it all, and as being a mom, like you said, she will be fine. Yeah, we can do the best we can, and if they're not involved in all the activities possible, it's okay. At the end of the day, we're doing our best. Yeah.
I think sometimes I have to be careful that I'm not putting my hopes and dreams and expectations on her. And so sometimes I like to check in with her and do you want to do competitive gymnastics, or do you think I want you to do it? Is that why you're doing it? And for now it's what she wants, and so I will support her in that. But I know that at any point, if it becomes too much mentally, that we need to back off, obviously.
Right. That's great that you're bringing up that, and you're recognizing you don't want to project your hopes and wishes, because I think maybe knowingly and unknowingly, a lot of parents live vicariously through their kids, and what they couldn't do, then they expect and want their kids to then end up doing, whether it's gymnastics or dance or whatever else. But that's very good to recognize that.
I've had a lot of I don't know if it's given me a lot of peace. I think I saw this on another content creator video, but it was like, you are not your child's engineer, you are their shepherd. And I was like, that is a very freeing thought, right? I am not going to build my kids into this perfect person, right? Because you just can't.
No.
And I think it helped a lot because I have a special needs kid, because a part of me for a while was like, oh wow, if only I get the right therapy, she'll talk. And I'm like, that's probably not true, right? Like that, there are, things I can do to give her the best chance of being verbal and being, having more independent skills. But there's some things I just can't overcome, right? So I can be there for her. I can kind of set up opportunities that might help her, but it's not my fault, and it won't be my win if she talks, right? It will just be what happened, right? Like what I helped guide potentially, but I'm not in there, in Broca's area, manipulating the neurons, and I'm going to make them speech, you know, like it's
the part of the brain here that helps you speak, Broca's area.
Yeah, it's not, I hope it pointed to the right side, but it's not, that's not me, you know, like I can't do that.
That's interesting you brought that up because seeing it as our wins, is that because we're looking for that reinforcement of I'm a good mom. There we go. They did it. They reached that milestone. They were able to, she can speak or whatever it is. See, I am a good mom. And I think if we're worrying about all of these different things that we've talked about, I think that already shows that we're coming from a place that we are good moms to be even, you know, wanting to make sure of all these things in the first place. And reminding ourselves of that is so important because I think sometimes we can use guilt as a compass or as a driver for our decisions when, you know, you were saying at first, you had like earlier, like with self-care, you had stopped working out and like kind of I feel like self-care gets cut first, especially as moms. Like,
it seems superfluous.
Right? Like, when I have to make sure my kids are fed and they get their naps and whatever else, that seems to be a higher priority when, like you said, we need to be taking care of ourselves to show up as our best selves. But definitely unlearning that is huge because we will burn out. But I've noticed moms especially, and then if we're working moms and then as physicians, it's like, like you said, superfluous. But not. But it's not.
Really isn't. I feel like the guilt is potentially endless. You know, you can have guilt about anything. And like last night, I was tired and it was a tough day, and I ended up just shouting at Olivia before bedtime, and you know, didn't say goodnight, and I felt so guilty about that. But sometimes, you know, I think we have to give ourselves more grace than we do. And, you know, we don't. And we're very hard on, I think all moms are hard on themselves, but I think especially physician moms, that perfectionism is always, you know, in the back of our minds there. So I think giving ourselves more grace much of the time, recognizing that we are human, we have limitations, we have our breaking points.
Yes, absolutely. I appreciate you sharing that because that's so real and I think helps. And I think for other people to hear that, hey, we have all of this going on in the background and in our lives, like, you know, outside of work, especially as working physician moms and especially in EM. And also another good thing to add to that, aside from, yes, we're human, give ourselves grace and more self-compassion, and we do have limits. And there's repair, like the opportunity for repair. I think that's something that I may even forget sometimes and want to remind myself of that, hey, we're going to have moments where we shout and yell and we don't mean to, and especially at the end of the day, oh my goodness, when your reserve is lower, right? Right? And then you know, it could be like when you know, I'll wake up the next morning like, hey, honey, I know I had shouted last night. Like, I didn't mean to. It was, I was having a hard time or a hard moment, and I love you. And to say I'm sorry, I think that is something, at least when I was growing up, parents didn't have that in their vocabulary, honey, like, you know, to process after and conflict resolve and to say even just those words, I'm sorry, honey, that I did that. I didn't mean to. How did that make you feel, even like to go beyond? Because I think that goes a long way. Most parenting mistakes can be repaired. It's something to keep in mind. It's not, you know, it's something you'd want to brush under the rug, like, oh, they're not talking about it, they're not bringing it up, I guess it was okay. But no, you know, consciously or especially unconsciously for kids, it's there. And it's so important to bring up like, hey, yes, this did happen and that wasn't okay. And to teach them that, because then also they learn like, oh, if someone were to treat me that way, someone else, like they'll recognize, oh, that was not okay. Oh, I didn't like how that made me feel too, to recognize the feelings there too. But I think that helps with giving ourselves more grace and compassion in that, in knowing like, hey, you know, I'm gonna have that convo with her, like when we can.
I like repair. That. I feel like there's a good parallel there between medicine and maybe being a parent, and maybe how the culture has changed, because more and more we're supposed to be forthcoming with our errors in medicine, right? Like there was this either there was or a perceived culture of kind of non-disclosure, before our time. And now we disclose. Like if I make a mistake and I know I made a mistake, I tell patients right away. And that process is difficult, but I find it builds trust and we grow from it. And I did not know how often mistakes would happen. But they happen all the time, and they're genuine, and they're both like diagnostic and procedural, and you could be doing your absolute best. Like the best doctors I know still make mistakes. And I'd say the same for parents, right? I am trying my best. I'm not going to say I'm the best mom, but like I make mistakes all the time. Like, right, my kid, Ian is wow, man, I love him. But he, like, I'll get to my wit's end and I'll be like, I will yell, right? Or and he'll be like, I can't believe you did that. And I'll be like, oh. But like that's
wow.
Yeah, I hate you. You're the worst mom ever.
Yeah. There's not a lot of good validation for
right.
Yeah.
It's so triggering. It's so hard not to be triggered, for sure.
I feel like it's very rewarding to be a parent, but there's not a lot of like you're doing this right? Like there's not a roadmap. Yeah, I didn't make that diagnosis. I didn't get them the right treatment. It's like, oh, did I do that right? Like your kid asks you like.
You don't know until 20 years later.
Oh my God, yeah. And it's like you said, like it's a work in progress.
It's a constant work in progress.
Absolutely.
And I feel like I always try to apologize, and I feel like she's receptive to that. I think it is really important for children to realize that you are not infallible, and then that makes them realize that they are also not infallible. No one is infallible, right? And that you have to develop that grace for yourself when you make a mistake. And I think being a parent is hard in general. When you run into a difficulty such as Claire's diagnosis, and this is not comparable in any way, but Olivia was diagnosed with ADHD, it makes parenting that much more challenging, how to navigate that, that you're doing it the right way. So it's very stressful.
Oh yeah. For all the like anxiety I've had in my life being like, oh, what if this happens? What if this happens? The things that have really rocked me, I didn't even predict. They were like so far out of left field. I was like, I can't believe what? My daughter has maternal 15q duplication syndrome? Like, never even heard of that. Like, I didn't know to be anxious about that, and now it's such a like, both like a very big but also small part of our lives, right? But
she's doing amazing. She really is. And that's really a large credit to you and your husband for how, on top of everything that you are. So you really are giving her the best chance at success, and she's thriving.
It's like it feels like such a like I have to do something, like, and then that's another worry. You're like, am I ignoring one kid for the other kid? Am I balancing parenthood? Oh yeah.
I wonder, Mary, if you're okay with it, would you go into more about Claire's story? Because I know you've touched on it already a bit, but it would be great to hear.
Claire was my second born child. She's 4 years old now. I'd say like right away, like I look back and I thought something was wrong, but you worry like, am I overthinking this? I'm like medicalizing my own child. I remember like they like right when they even put her on my chest in the hospital, I was like, is she okay? Like she's so floppy and like she's not moving as much. And they're like, no, she's great, don't worry. And then that started like a year journey of a diagnosis, because I'd say like the exact opposite specialty of emergency medicine has to be pediatric, just neurology and genetics. Like it's like genetics to emergency medicine is a pretty, big practice jump. So, like as she missed milestone after milestone, and I was, I blamed myself at first. I remember thinking like, this is my fault. Like I'm working full time and I have 2 kids, and that's why she can't roll over, because I'm not on the floor with her more, teaching her how to roll over. And I'm, I think like going to waiting for appointments and talking to subspecialists. And I remember at her first early intervention evaluation, like they give you the report, and how many tests have we taken? I'm anxious about tests. I'm like, I need to do the best. I want to be, high honors at least.
That gets reinforced for sure for us, right?
That's what I'm aiming for.
Right.
And like they like showed me the report, and she was like 2 standard deviations below in every category. And I was like, oh my God, like you guys know that feeling, right? Like something's wrong.
Right.
It's a lot of gaslighting
Oh,
you
yeah.
experienced even as a physician.
Oh, yeah.
Yeah.
You know, like I wonder about that all the time. Like people kept saying like, oh, she'll catch up. And I was like, but like how? Like how is she going to catch up? Like why is this all happening? And I had never, you know, outside of childbirth, I had never been myself a patient. And then suddenly my daughter's having eye surgery at 6 months. And we're going to like, we had an ultrasound of her brain, and we're getting whole genome sequencing, and I just testing I had never even thought of, or like not been part of my practice or my life. And then like, oh my God, like you can imagine I'm there for a lot of people on the worst day of their life, right? And this is the worst day, right? This is the worst thing that could happen to you. And like for me, like that, you know, hopefully life is complex, but like the worst day for me was the day we got her diagnosis. And, you know, I get a phone call, and she has this maternal 15q duplication syndrome. And I'm like, what is that? And we're like out hiking, our whole family, and I'm Googling it. And, you know, you pull up like the NIH fact sheet on it. And I'm like, oh my God, like it was like severe, it was like severe intellectual disability, nonverbal, like hypotonia, sudden unexplained death and epilepsy, seizures, and just like unbelievable to like get that diagnosis. But like at the same time, it was a relief, right? Because I had an answer, right? And then suddenly like that grew into like I had a whole support network. There's a Do 15 Parent Alliance, and there's research, and there's hopefully going to be clinical trials, and there's so much hope too. But like it actually getting the diagnosis made such a difference for me, because I had blamed myself before that. I was like, maybe it's because like, did something happen in labor? Was it a perinatal stroke? Was it working on those? I had like shifts in my brain. Like I would rethink, oh my God, that last couple of weeks I had some really hard shifts. Was it like, did she have a perinatal stroke we don't know about, because I was dehydrated and 38 weeks pregnant, you know, running around an ER.
You go down that rabbit hole.
You think, how could this be my fault? And then to know, like, you know, it's a genetic disorder. Like, is it my fault? Actually, yes, exactly. It was a problem in my egg. And it was exactly me. It was. But like, was it something I could control? No. And like, I am, you know, grateful to be a physician mom, because I think it set me up to help her in the best way possible and get her diagnosed early. And I think it will help me help her throughout her life, right? Because the medical system is so complex. It's so hard to navigate. If you don't have any experience in this world, trying to get your kid the right care is very hard. But
I think that really has formed how you've helped people in the ED that you've been able to come into contact with and try to set them on the right path, because you know navigating the complexities of that kind of care.
How hard it is.
Right.
Like,
absolutely.
and I feel like now I never really understood what it's like for some of these, like I see the whole spectrum of parents coming in with like a nonverbal kid who's just crying, right? Like, what's going on, right? That like agony of your kid can't tell you what's wrong. And then like across the spectrum, right? Like I like every time I see one of those patients, I pick them up right away. It's the intellectually disabled, you know, verbal, nonverbal adults who are alone, right? Because that's one of my, like, that has become my deepest fear, right? That one day I won't be there for Claire, right? Like I hope that never happens, right? Like all I want in life is to live just a little bit longer than her, right? Sorry, I don't want to cry during your podcast.
No, that's okay. It's okay.
Right? Like,
I totally get that.
You have so much support and family.
Yeah.
You know, I don't think
that will ever happen. Yeah.
Right.
But we see them, right? I see these adults who are alone in the world, and like it's so hard. And like when they're in the ER, it's scary for any person to be in the emergency department. But to be someone who like really can't understand the world around them or communicate with the world, it's so much harder. So I like a lot more, like more empathy, right? Like empathy I could never have understood before. And I do think it makes you a better doctor. Being a mom makes you a better doctor, period. You know, are there great physicians who are not parents? Yes, of course. But like, it's, at least for me,
gives you a different perspective.
It made me a better doctor. Yeah.
No, I remember when Claire was first diagnosed, and just a lot of hopelessness, you know, and I hope that I tried to.
Oh, you're very big support. Yeah.
It wasn't endless or hopeless. You know, I think that's something that we really need to do for other moms in general, right? Is to be there for them and build them up, and women in general. I like to do that.
Yeah. I don't know if you remember that. I like very much remember that I like got this diagnosis. I want to say it was on a Tuesday, but I'm making up the exact day. And I had 3 night shifts after that. And I was like, I like it really was like the worst news I could have gotten. I couldn't go to, and Katie worked my shift, and I felt so nice. I was like, I can't call off, and she's like, you can't go to work, and I was like we have to, like, there's some situation, like, we very much, I'm very grateful for you, because I probably would have gone to work, and I shouldn't have gone to work.
I'm very grateful for you both. Absolutely. I mean, we have to be there to support each other, because I think that is one thing that is very much lacking, right? There's not really a community. So to have community is huge in motherhood.
Absolutely. Especially, I've mentioned it, I think, earlier in a reel or previous episode, that we are particularly siloed in the United States, I feel, with the way American culture is. It's like, we all have our beautiful homes with the white picket fence and the family, and then it's like, sometimes I hear like, from friends, no judgment, but like, if I'm taking out my garbage and I see the neighbor, I'm like, I wait a bit. I'm like, wait, why? Like, have you heard that? Go talk to them. Yeah.
I hear that from my husband. He's like, Mary, don't make eye contact. I was like, please, come on.
Okay, you know, but you're braver than me. I said friends, but it's my husband too. He's like,
you mentioned me in the podcast.
But then it's like, oh my goodness, we're already so isolated and siloed. And then when you become a mom, it's like, where's the village? We were meant to raise kids in a village, and that's why that saying is there, that it takes a village to raise a child, because that's how, for the majority of our species, that's how our ancestors did it. They had each other, they had community, they had all the relatives around, and that big support network, and kids were able to really thrive. Like, all the resources were there, like, easily accessible and around them for parents and for kids. And it's so different now. There's pros and cons, obviously, but I feel, I really feel for those. That's one of the many things to go to the Hill for, like, as far as resources. And, if we're lucky to have our parents or extended relatives to come and give extra hands to help, that's great, but not everyone has that. And I really feel for that, for those. There's so much that to be done still. And then I think going back to giving grace and self-compassion, I think, think about that even more so if, you're really that person, or like the mom, like, it's all on you in running the household and taking care of the kids and getting them to school. And then if you're working too, and oh my goodness, I can only imagine for the single moms too, doing all of that. To an extent serves a purpose where we're on guard and wanting to make sure everything gets taken care of, but not if we're blaming ourselves and feeling excessive guilt and being hard on ourselves in that way, because then that's when it becomes detrimental. We tend to look at ourselves first, like, okay, what did I do wrong?
Oh, yeah.
Where did I go wrong? Or this must be my fault, isn't it? And I think that goes back to also our need for control, because if it's something we did, then it was something that was in our control. So I think that's why our minds tend to do that. And looking back and thinking, is this my fault? Probably, what did I do?
I mean, 100%. I think I always knew that we were going to arrive at some diagnosis with Olivia at some point. I just didn't know what it was when she was younger. And I remember thinking, I did this because I bathed her in cortisol my whole pregnancy. I bathed her in stress.
But you do. You think about that.
And, all the things. But, that is a real thing. I think we definitely tend to self-blame. I think, to add another point to community, I feel like people are trying to find that community online. And I think that that's an amazing thing. But I think there's too much of women tearing each other down and being very judgmental. And then that is obviously counterproductive and isolating, like I really think we need to let go of this mean girl mentality where we need to stop tearing each other down and we just need to build each other up.
Yeah.
Absolutely.
Yeah, you do worry about getting I feel like you asked we should have community, right? Like I think why I'm trying to run around sometimes to entertain a 6-year-old boy and like I really can't do it. I need to have a play date. But then I think I got to invite somebody over and they're going to see how messy my house is. And I can't, I'm like, I got to clean this house, but I can't actually clean when I have the kids alive and awake in my house. So that's like a catch-22 where I'm tired. I'm running around the backyard chasing this kid, playing tag and whatever. And I'm like, oh, he really needs like 4 other boys to play with him. But I'm too worried about the judgment of 4 other families seeing the state of my house on any given Saturday. Yeah, that's true.
Right. Likewise. I think this means we need to have more play dates. I think that all the time too. I'm like, oh, the house is a mess. Like the crumbs everywhere and whatnot. And you think you don't want to invite people over.
Unfolded laundry on the table.
Right. But that's totally something to let go of too, I feel like. But it's hard too with letting go of the judgment of others. And it goes back to that image, the perfect image of being a mom and having it all together and having the perfect house and like a smooth morning of waking up and you get ready and the kids get ready and you drop them off to school and bye, honey. And then you go off to work. Oh my goodness.
No. With your high-toned, sweet voice.
Yeah.
Perfect mommy voice.
Yeah, right? Exactly. It's
After making like a delicious and nutritious breakfast that everybody ate. Like I make breakfast and like everyone stares at me and is like, where are the Fruit Loops? Like, I'm like
right. Sometimes, and then you have to do what you need to do sometimes for survival. I think that's another thing too. Yeah. Like, okay, did you get basic needs met? They're alive and, safe?
Yeah.
Check.
Sometimes that's good enough.
Yeah.
Right. Yeah, I think embracing being good enough is a great landing place of, okay, I did what I could. Yeah, there were other things I wanted to get to and I didn't, and that's okay. And my kids are alive and well. I'm okay. We're safe. Whew, okay. Let go.
I feel like sometimes you compare yourself to your old self. Like I was like, wow, I did all this stuff. But when I was younger, like I traveled and hiked and volunteered and had a job and went to school. And I was like, but I didn't have kids, right? Like
the pre-kid life.
Yeah. The people who do that stuff with kids, they are the superheroes. Like, I don't know how they find time in the day, but like, there's just not enough.
Most of them have help. I don't.
Oh yeah.
You just have to.
You need it, right? Yeah. But there's you can't be as productive. I shouldn't say that not productive, because like, is it not productive to like spend a day just playing with your kids? Like that's a great day, right? But then you can't accomplish every single goal, right? You can't write a book and volunteer and all the other like aspirational things. Start a business, right? Like how hard is it to like have the mental energy to be like, I'm gonna achieve this goal, when you also have to figure out like, did I make that donation to the PTA? And did I pack a lunch today? I don't.
There's endless amounts of mental tasks that you have that clog up your brain. Absolutely. Yeah, I was having this realization the other day where I was just like, my God, my house used to be pristine. Everything was in its place. Where is all this clutter coming from? And I was so angry with myself and so frustrated. And I was just like, you know what? That's not your life anymore. That's not realistic. This is who I am now. I have laundry that is folded in a basket, not in the drawers. And it's been sitting in the hallway for 3 weeks. Yeah. And that's where we're at in life right now.
Yeah. Right.
And it is what it is.
Yeah.
I love that you're bringing that up, because it's letting go of those expectations and that pre-kid life mentality. I think there's definitely a huge mental adjustment there that happens where, things you used to be, doing all of these different things and had the energy for it. And I think also that's when we were younger. I love that energy from the 20s. Oh, yeah. I sometimes
28-year-old me versus 38-year-old me, very different.
Yeah. Sometimes in my mind though, I still feel like I haven't adjusted yet. I'm like, I stayed up late and I did this and this, and it was so productive in the day. Like I still think I have that kind of energy, and then I'm like, why am I tired and it's only noon? Happens all the time. But Yeah, I think that's normal. I think also it's because pre-kid life, like we were able to relax when we wanted to. Yeah. I think that was the adjustment too of and we were able to get 8 full hours of sleep uninterrupted. So of course we had more of that energy. So there was that. For sure. In my car, I kid you not, I have these women caffeine gummies for you to help get up in the morning. And it's advertised as such. I kid you not. I have to bring, read the full label. Yeah.
I'd love to know what's in that because I really worry about the amount of Celsius that I drink now.
Oh, yeah.
I don't think it's as healthy as they say.
Oh, there's no way. No. Yeah.
Oh,
then now they're gonna sue us for being like, and they're like promoting it, then they're de-promoting it. It's like, yeah.
Don't worry about the long term.
They only mixed it up with the alcoholic high noons one time. It's not that many times.
How many milligrams of caffeine is in 1 Celsius? Oh my!
It's a cup of coffee, right? Yeah, a little stronger.
I think that's
coffee, like double.
I think that's like 2 espressos at minimum.
Wow.
Yeah.
Yes.
That is a lot.
400 milligrams. That's the
ceiling.
Ceiling.
Mm-hmm.
Oh my. Well, oh my goodness. I feel like we could keep going and I want to, but we'll definitely have to do this again and get together and continue all of these good talks. So I want to say thank you both for joining me on this episode where we barely cracked the surface, I think, in talking about all there is to being a mom, a working physician mom, and especially for you two as emergency medicine physicians. Thank you so much for sharing your experiences with Olivia and with Claire and bringing awareness to the Dupe 15 world. Because when you were telling me about all the resources out there and the organization, and you run half marathon. This is a half marathon runner too, by the way.
Just the New York City half like 2 weeks ago.
So my goodness, amazing. There's so much you're doing to raise awareness, and I didn't know it's like this whole other world. So I love that. Thank you for sharing her story and your experience on this podcast so others can hear. So
thank you for having us. This is a great opportunity. Really like fun. I enjoy this conversation a lot.
Yeah, me too. Thank you too.
Thanks, Kavita.
Yeah.